name is Eileen Noel. I'm a school nurse at an elementary school, and today we are going to be talking to first-year nursing school students on how to use a glucometer prior to their first clinical experience. How exciting. So I am going to be using the teaching strategy of demonstration, and I picked this because it's well suited to learning psychomotor skills, and it provides a mean of education for instructors to determine how much learning has occurred. The objective of this is by the end of this session, students will be able to properly use a glucometer. Before starting, I'm going to go ahead and give a quick history lesson as to how diabetes came along. Diabetes dates back as far back as 1552 BC. The exact term diabetes came along in 250 BC, and it means to cipher or to go through. And they chose this term because patients were not able to consume as much water as they were losing. And back next in the late 11th century, they didn't have methods of actually testing for diabetes. So what they used were water tasters. And water taster job was to sip the urine. And if it tasted sweet, then the patient was diagnosed as diabetic. So I know we're a little hesitant today on sticking ourselves, but let's just go ahead and think back to the water taster days and be glad that is no longer part of our nursing duty. So let's go ahead and get this demonstration started. I'm going to go ahead and show you the glucometer. The glucometer they can get it at Walgreens, CVS. Good thing about this is more likely what your patients will be going home with, and now you'll know how to use it and demonstrate to them prior to discharge. You're going to go ahead and have a strip. This strip is looks like this. This is the blood receiving side, and this is the part you put into the glucometer. It looks like a piano. We'll talk a little bit about that later. You're going to have your lancet and your lancet holder. We're going to go ahead and insert our lancet into our lancet holder and push it in to activate it. You're going to leave a little tip on so we don't have accidental needle stick. Next, you're going to have your alcohol pad, and then that's all you really need right there. So what we're going to first do is insert the test strip into the glucometer, and it automatically turns it on. And you're going to see that it has a little dot or a little drop saying it's ready to receive blood. We're going to go ahead and get our alcohol pad and wipe on the side of the pad, never on the bottom or on the tip, because the finger has a lot of nerve endings and we don't want to inflict more pain than we have to. And remember, if your patient's hands are physically visible dirty, you want them to wash their hands. But other than that, alcohol should suffice. What you're going to do now is you're going to go ahead and grab your lancet. You're going to twist off the little protective tip here. You can get it off. Protective strip here. You're gonna hold it up to your finger, and then you're gonna push the button. Then you're gonna see there's a little poke. You're gonna want to squeeze gently. You don't want to squeeze too hard because you're gonna lyse that red blood cell. You only need just a little bit there to squeeze. So now that you have that, you're gonna go ahead and put your test strip to the blood, and you're gonna hear a beep when it has enough blood. And then now it's going to read. You might not have been able to hear the beep, but that's fine. Wait a couple of seconds there. You're going to put a cotton ball onto the site just to stop the bleeding. It'll stop almost automatically. Here's my result. You're going to record this in the medical record per hospital protocol. And once you're done there, and that's it. So now what you're going to do is you're going to break into pairs. You guys are going to practice with the glucometer. Once you feel comfortable and ready, you're going to go ahead and come up and demonstrate your new skill. Thank you and have a great day.